Good evening and welcome to the latest in the Anaphylaxis Campaign series of webinars. This evening I'm joined by consultant dietitian Isabel Skypala. Welcome, Isabel. We're going to be talking about food allergy in adults and the role of the dietitian. Just going to wait a couple of seconds for everyone to get sorted and everyone to be comfortable, and then we'll start. So, the webinars that we run are aimed at giving you a bit of an insight into various aspects of allergy. Throughout the course of the webinar, you are able to type in questions so that we can answer them afterwards. We won't be able to answer anything as we go through, but we will be able to take your questions and get back to you by email after the webinar. So please feel free to ask any questions using the box on your screen. Please note, however, that we will try and cover as much as we possibly can in the next half hour, so we may well cover your particular issue. If you find that we don't, then please feel free to email us via the Anaphylaxis Campaign website afterwards, and we'll do our best to get back to you. Also, please remember that the webinar will be available to watch again via our website, which will hopefully be up and online tomorrow. So, Isabel, thank you very much for joining us this evening. One of the first things I think it would be interesting to look at is what is the role of the dietitian, and how does a dietitian fit within the whole sort of allergy service, particularly for adults?
So for adults, it's usually that a dietitian would see the adult when they come to clinic, often after they've had a diagnosis, seeing the consultant. Of course, with adults, you get adults who have had a food allergy for many years, who may feel that they know everything that they're doing and they don't need to see a dietitian. And you also get newly diagnosed adults who obviously would benefit from having some advice. But what I would say is that we do encourage all adults who are coming to clinic to try and see the dietitian if they can, because what you need from a dietitian can change as you get older. So you might be living with mum and dad and they're buying all the food and cooking for you, and then suddenly you're going to university or you're going on a gap year, and the dietitian can give you lots of advice about cooking and what to buy and what to eat when you're out or when you're abroad.
And when you're talking about adults, is that from 16 in some cases, as young as 16?
It can be as young as 16. 16 to 18 is often the age. It depends on different areas, transition.
Sure.
Different ages.
So don't be surprised if your child is 16 and they're maybe being referred to an adult clinic. That's perfectly normal.
That's normal, and I think it's helpful actually, because it means you get to know them before actually they have to make some of those big changes.
Yeah.
So they're already familiar with the dietitians and what they need, and the dietitian can then help them through that when the time is right.
Mm-hmm. So specifically, what advice do you give on eating, staying safe, and particularly around food labelling?
Okay, well, if I was seeing someone new, if they were referred for a new allergy, then obviously I'd give them advice about where they might find that food. For example, if it was shellfish, what foods would normally have shellfish in, but also when they're eating out, what to look for, what kind of meals or what kind of countries are they more likely to have shellfish, and particularly cross-contamination, because as you know, with nuts and shellfish, these are proteins that are very difficult to destroy. So you know, eating out for someone with a prawn allergy can be difficult if they go to a Thai restaurant, because even if they don't eat the prawns, they might get prawn allergen in their food. So it's giving them those kind of practical hints that is really helpful, and obviously talking about different types of takeaways and how to minimize those risks, apart from just saying don't eat out, which of course we don't want to do. You know, it's about giving them practical knowledge and tips. Recipes, probably not so much unless someone's really keen to cook. I think in the paediatric clinic, mums often ask for recipes, but in my experience, adults are generally, if they want a recipe, I can recommend a cookery book, but usually they want that kind of what ready meal can I eat, or you know, those kind of quick and easy meals dangerous situations if you're out with friends, what to avoid. And of course, you know, making sure we all do as a team, we all re-emphasize the point about carrying medication.
Yes, and that's a really important message for children, of course, but also for adults, because sometimes adults are maybe not quite as careful because they haven't got their parents reminding them in the background. Yes. So you would actually reinforce that within clinic?
Always. I would go through the anaphylaxis plan if they've had a severe reaction. You know, I think it's good if they have that plan reinforced by everyone that they see in the clinic. So we're all giving the same message. Are you carrying your adrenaline? How many adrenaline auto-injectors are you carrying? You know, when would you give yourself, you know, when would you give yourself adrenaline? Because I think as an allergy team, that's part of the basic core knowledge that all team members should know.
Yeah. I think that's really important advice, and obviously it's advice that the Anaphylaxis Campaign give as well, is to always carry your adrenaline. And I think it was interesting you mentioned about plans for adults. So adults who've got a severe allergy, who've had anaphylaxis, and even those at risk of anaphylaxis will have been given a plan.
They should all have been given a plan, and you know, if they've had a severe reaction, obviously not everyone does have a severe reaction, but it's important to go through the symptoms and make sure they understand, particularly young adults who are out with friends, you know, and socializing. They need to be aware that they may not be so good at picking up on those cues, so I advise them to discuss it with their friends, watch videos online, and just be aware of the early signs and get their friends to, you know, is my face red, or they will say, oh, your face is really red, or, you know, so that, because you don't always realize yourself that that's what's happening.
That's really good advice. And one of the things that we hear a lot of is people complaining about food labeling.
Yes.
Tell us what advice you give to people who come to your clinic about may contain and what would be called precautionary labeling.
Okay. So that's a very contentious area, and the advice that people give will vary a lot between the clinics and between the patients, because there are some people who really don't need to avoid may contain foods. For example, people who have pollen food allergy, where they're reacting to the pollen but they're having cross reactions to foods.
Is that oral allergy syndrome?
Oral allergy syndrome is what it's also known as. And those are people who have this condition will be affected by nuts, but only when they actually eat nuts, and it's usually a mild condition. And if they're avoiding the nuts, they don't need to worry about nuts in the foods, because generally they don't cause symptoms, especially foods that say may contain. If someone has got a very severe allergy to and is likely to react to a trace of milk, it's usually milk, shellfish, and nuts, then, you know, often I will say they need to avoid may contain. I think the problem is that the research that's been done is very difficult to interpret, because some studies have found that may contain food labels, the foods actually didn't contain any nuts, and other studies have actually found nuts in foods that didn't say may contain. So I think I always say, don't rely on what's in front of you. Rely on your common sense. And if you're going to have something that you're not sure about, don't do it when you're in a situation where you're miles from anywhere, or you're in a foreign country and you don't really not sure. The time to take a risk is not then. The time to take a risk is at home, if you feel that you really want to eat that chocolate bar, even though it says may contain. But there isn't I don't think there is a hard and fast rule. It has to depend on the individual circumstances. I think it's a very difficult area, and I don't see anything coming soon that's going to change that. I think the good thing is that the labelling that we have now is very clear, and although I know the old days we used to have the allergy box, and we don't now, actually I think the current labelling works very well with being very clear that there's milk in this product, whatever it says in the ingredients, it will say milk after that. So I always point that out to people and say, have a look on the label, because it's really clear now. So yeah, labelling is important. And also now we have, of course, when people are eating out, they should ask for the allergy menu, or that if there isn't one, they should ask about what's in foods. But I think it still is the issue that they cannot necessarily, they have to trust their instinct.
Yeah.
If someone says there's no fish in this fish curry, and clearly there is fish in it, they need to think, well, maybe I'll have something else.
Yeah.
You know, because mistakes happen, things get left off menus, you know, and so I think it's really important still for someone to think, and that's why they need to see a dietitian, so that they will know there's fish in a fish curry.
Yeah, and I was going to say as well, it's also that's highlighted the importance of individual care, isn't it?
Yes.
So each patient you see will be completely different, and advice you might give in the morning will be different to advice in the afternoon.
Oh, absolutely.
Which is why it's very important to be seen by a specialist if you are at risk of anaphylaxis.
Yes. Oh, yes, you can see 5 people with a peanut allergy, but they all have different levels of reaction. They all have different lifestyles, different likes and dislikes, and you know, so it's really important that you treat them all as individuals, and don't, you know, we don't just give a diet sheet and here you are.
Yeah.
It's always about making that information as individually tailored to the person as possible.
And what are the most common food allergens that you see? Obviously, we know there's a list of 14 main food allergens. What ones are you seeing in adults specifically?
So if it's a newly diagnosed allergy, then the most common ones will be prawns, and also fruits and vegetables. And the fruits and vegetables is really linked to this oral allergy syndrome, this cross reaction between pollens and plant foods. That affects about 2% of the UK adult population.
And they develop that in adult life as opposed to as children often?
They can often develop it as teenagers, in fact, even young teenagers. So it can develop then, but it may become more apparent or more severe as they get older, and young adults particularly. So that's very common, where they get an itchy mouth when they eat a raw apple, but they can eat apple pie. It's that kind of, and the other one is as I say, is prawns and other seafood, but prawns most of all, because we have more exposure to prawns than anything else, and that may be now because we eat a lot more prawns. They're farmed, they're very cheap, and we have a big exposure to them. And so even people who've been eating prawns all their life can still develop an allergy. So prawns and other crustacean like crab and lobster, less common because you don't eat so much of it. But prawns we see a lot. So
you mentioned that we're seeing more, possibly because we're eating more, but do you know why? I'm not expecting you to know definitively, but this is one of the questions we get asked often with adults who've developed allergy in later life. Why do I suddenly get, particularly if they've eaten that food all their lives?
Well, the first thing to know is that you really have to be exposed to the food to be able to develop the antibodies against the food that will then cause the reaction. So it's not clear yet why people who've suddenly been doing that will get the allergy. I've seen people who suddenly develop allergies after they've had a baby, or when they get pregnant, or even the other way around. So they've had an allergy, and then when they've had a baby, it goes. Also, I think it's possible that things like medications that suppress gastric acid are used very frequently now, and it's possible that because they make the stomach less acid, some of these food allergens are able to be around, hang around a bit longer, and start to become recognised by antibodies or start to develop antibodies. So there is, I think people are interested in looking at that. Possibly stress may have a link. One thing we're seeing quite a lot of is the development of reactions only when people are eating a food and having a cofactor like exercise or alcohol. I think we eat a lot more. We have a lot more exposure to different foods. We also have a lot more cofactors. You know, we take a lot more painkillers. We're probably doing a lot more exercise, but in particular kinds of exercise. You know, we're drinking alcohol. So I think there's a lot more opportunities for food allergy to happen, but there isn't a particular pattern. All I would say is that people who have food allergies as adults usually have other allergic conditions like hay fever, asthma. They've often had eczema as children.
Yeah.
So they're kind of primed, if you like.
Yeah.
It's part of the allergic march.
Yeah, really interesting. And how many, so those adults who've had their allergy since childhood, how many of them are likely to outgrow it?
Right, okay. So again, that's ongoing research has suggested that it's not always as early as we think it might be, but sometimes it does still happen later on. It depends on the food, to be honest.
Right.
So if you've got a milk or egg allergy, then most adults will have outgrown that, or certainly be able to tolerate, say, cooked egg, baked milk, but may not be able to tolerate raw egg. But most of them will outgrow those allergies. Fish is really, we don't really know whether people outgrow fish allergy, but peanuts and tree nuts, again, most of that starts in childhood. There is a percentage that will grow out, about 10 to 20%, depending on whether it's peanuts or tree nuts. So it is worth definitely being tested for milk, egg and nuts, and we would look at the levels of antibody against those and then make a decision about whether it's safe to undertake a food challenge to then be able for people to be able to reintroduce them. But you do still see people in their early 20s who have very high levels still of allergy to milk and egg, but then even by the age of 25 their levels might have dropped so low. So I think, what I always do is say to people, well, you come to me at 16, you've still got milk and egg allergy, but I will carry on seeing you. You need to keep coming back. And not, oh, well, that's it for life now, and I'm going to just not come back and just carry on avoiding those.
Because quite often young people will be retested at around 11, 12. That's the general advice.
It was usually school, going to the next school.
And then quite often we see young people where that's it, and they're not tested again. So you're recommending that they should remain under the care of an allergy specialist all the way through their life, basically.
Well, not all the way through. So sometimes what we do is we have people at 18, we do the tests, they come back perhaps in a year and then in another year, and then maybe by the time they're 24 or 25, we've done the tests, we think the likelihood is that nothing's going to change. So usually what I say is come back in 5 years. And I may not be here, but it's important not to just say nothing's going to change, because things do change.
That's really good advice, and I think it's probably quite interesting for people that are listening to hear that it is worth still seeing an allergy specialist, even if you feel that your allergies are with you for the rest of your life. It's still worth seeing someone who can help with that.
Yes, we do challenges to people in their 40s and 50s who've never eaten egg, and suddenly they can eat eggs. So I do think I would say don't leave it that late. Because it could be that at least, even if you don't want to eat eggs, it makes a huge difference just being able to eat those baked eggs in food.
Remove a massive anxiety from people. So tell us, what's the difference between a food allergy and a food intolerance?
Well, a food allergy generally involves the immune system, which it usually involves antibodies called IgE antibodies. But there are other types of food allergy. For example, celiac disease is classified in some classifications as a food allergy because it involves the immune system. So there are non-IgE mediated food allergies as well. They're much more well recognised in children. I think we're not very good yet at recognising them in adults, but they do exist. A food intolerance is a reaction to a food that's caused by the food specifically, but it's not a problem with the immune system that's causing it. So a good example would be milk. The milk sugar, lactose, isn't well tolerated by people, often because they have very low levels of the enzyme that digests it, called lactase. So if if you have a glass of milk and then you get very unpleasant diarrhea, you probably haven't got a food allergy if you're an adult, but you may have a lactose intolerance.
Right.
So there are definite enzyme deficiencies. There are also people who are more sensitive to natural histamine in foods, and histamine is the substance that gets released when an allergic reaction happens, but it's present in foods as a breakdown product. So there are people more sensitive to some of these natural food chemicals, and then there are people who are also sensitive to some food additives, like sulfites. Sulfites are used to prevent browning in foods, but people who have asthma are often quite sensitive to sulfites and can get a bit wheezy. So there are different food intolerances. So generally we would say, they are sort of enzyme deficiencies like the lactase thing. They're sensitivities to high levels of natural food chemicals, or their sensitivities to some of the food additives. But there are also people who have reactions to foods that are really more about digestion.
Right.
And in adult food allergy, there is a big crossover between people who have digestive issues and people who have a food allergy. And sometimes people who have a food allergy also have digestive issues. So I see a lot of people who have, they eat bread and they feel bloated, but wheat allergy is very rare in adults. So often it's a case that they're not very good at digesting the wheat, the starches in the wheat, and it's not a food allergy.
And that's a really quite a current topic at the moment. We hear a lot about clean eating and people with sort of ideas that maybe if they cut out certain food groups they will be healthier, or it might get rid of some symptoms that they perceive are allergic symptoms. How do you cope with that type of thing in clinic?
Well, I always say to people, if you're having symptoms, I get a lot of people who I don't necessarily see but might email or call me. I say, if you think a food is causing a symptom, the first thing you must do is go to see your doctor, because it might not be that, it might be something else. It's really important that you get a proper opinion about what it could be. Just cutting foods out is never a good idea. It can make things worse. There is lots of advice on the internet about diet. Most of it, a lot of it is coming from people who are not trained or qualified to give advice. So they're giving advice very much based on their own experience, which is absolutely fine, but we're not all the same. And there are some diets which are dangerous for people with allergies to follow. It's dangerous to cut whole food groups out because you don't know what the result might be. So I think it's really important that if people want to eat healthy, and I've got nothing against healthy eating, it's important that they feel that they can do that. But I would say don't cut out so many foods, because if you cut out a lot of foods, you're relying on a very few foods, and that's not good. It limits your nutritional intake. Also, I think there's a big emphasis on, things like smoothies and having lots, and it's important to have fruit and vegetables. But equally, I think it's important to remember that a lot of adults do get allergies to fruits and vegetables. And so, people come to me and they're saying, oh, these are the bad foods, the wheat and the milk and the artificial colourings. And actually, the people who have food allergy are often allergic to the, the vegetables and the fruits and the seafood, that's, all the things that are quite healthy. So I think the thing is, you should enjoy what you eat. You should eat a healthy diet and try and not have too much fat and sugar, but don't go to extremes. It never works in the long run.
No, and it is perfectly you're perfectly able to eat a good healthy diet even if you have food allergies, even if you have the food allergies in the sense that they're IgE mediated food allergies. You can still eat a perfectly healthy diet, and you would give advice on that.
Absolutely,
as a dietitian.
Yes, lots of people with this pollen cross-reactive food allergy, the oral allergy syndrome, will often say, oh, there's no fruit I can eat, and so we go through and, you know, can you eat blueberries? Oh yes, actually I can eat blueberries. What about bananas? Oh yes, they're fine. Oranges? Yes, they're fine. And I think sometimes it's that feeling of I can't eat anything, and actually there's lots of alternatives, and it's just about understanding what they are and feeling confident because someone said these foods are generally okay, for you to feel confident to try them. It is about having alternatives, because it's human nature. If we know we can't have something, we want it.
Yes.
And we feel like we can't eat anything. And
yes.
So it is about being prepared and understanding what the alternatives are, so that you can enjoy.
Yeah, because I think that there is obviously an understandable anxiety if you have a food allergy, and you do often think if you can't eat this food, maybe you should cut out all the foods. And of course, what we're talking about today is seeing a dietitian. And what we find is that a lot of our adult supporters find that it's quite difficult to get even a diagnosis.
Yes.
So how do you go about getting a referral to a dietitian, or at least a sort of specialist team? And I recognise that not every hospital will have someone like Isabel. So, but a similar sort of service. How would people go about that?
Well, I think obviously you have to go through your GP.
Yeah.
And actually, adult allergy services are increasing a huge amount, I think, and because of guidelines about allergy services and what standards they should follow, they have to have a dietitian as part of their team if they're going to be registered as an accredited service. So you should ask your GP. There are dietitians who work in the community who will be able to give advice, because all dietitians can give individual advice based on a person's own dietary needs, so it doesn't have to necessarily be a dietitian who's in a specialist allergy team. I think if you've seen if you have an allergy diagnosis, and then ask to see your local dietitian that will work in the in the community, because they can still give helpful advice even if they're not specialist dietitians. Of course, it's better if you can see a specialist dietitian, but there are a lot more of us now than there used to be. But I know that there is not still one in every area. And I think if you've seen a consultant, paediatrician, or obviously as adults you would then go on to the adult service, ask if there's a dietitian in the team, and be insistent about seeing them, because I think often what happens is people think, well, it's only a peanut allergy and it's easy to avoid peanuts, and actually that's exactly the problem, is that often the thought is, well, you can just cut that out, but actually unless you go through someone's individual diet, and they could be eating loads of nuts, they could be a vegan and need to eat nuts. So it's really important to say, well, okay, here's a dietitian who can give you advice about what's the substitute instead, and can you have wasabi peas if you're allergic to peanuts, because they're both legumes. It's those kind of things that you need. They're practical things.
And it's back to the individual again, isn't it? And I think that's the important thing when you're dealing with allergy.
You know, and actually the dietitians who work in allergy have a very good network. They have a network linked to the British Dietetic Association, and if you know your paediatric dietitian that you've been seeing for years, they will know adult dietitians. They will know, they can find out which adult dietitian is in your area, and so if you ask them, they can email around, say, is there anyone seeing adults in this area? And so I think it's always worth, if you've been seen in the paediatric team, to ask them who is good to see in the adult service.
Well, thank you very much. I think that we've covered a wide range of issues, and I hope that it was helpful. I think the key things to remember are that when you're dealing with allergy, is that everyone is different. So just because somebody is doing something in one way doesn't mean that the way you're doing it is wrong. And it is important to get help from specialists. If you're currently not being seen by a specialist and you feel that your allergy is not controlled and that you do need some extra help, do go back to your GP. And as I said at the beginning, if you've got any particular queries that we can help with, you can email us via the Anaphylaxis Campaign website or call our helpline where we'll be able to help and advise. So thank you so much for your time this evening, Isabel, and thank you very much for watching. Just a reminder that the webinar will be available to watch again on our website, and watch out for other particular issues that we've got coming up in the year of the adult. So the Anaphylaxis Campaign is focusing on adult allergy this year, and we've got a number of things coming up. So do keep an eye on our website, or sign up to become a member if you want further updates on that. So thank you very much, and good evening.